Welcome to Healthy Mind, Better Future, a podcast dedicated to mental wellness. We are all challenged by psychosocial struggles. Families are broken, jobs are unfulfilling, neighborhoods are unsafe. Poverty and illnesses deter us from quality of life. We're stressed, anxious, and in despair. Healthy Mind, Better Future brings awareness and relief to those with mental health challenges. It offers practical tips for managing stress and anxiety so you can positively function in society. Our podcast panelists are Dr. Adeyemi Fatoki, a board-certified family medicine and addiction specialist, Dr. Caroline Olaleye, a board-certified pediatrician and primary care physician, Dr. Kenneth Soyemi, a board-certified pediatrician and general preventive medicine physician. I'm Funmi Onayemi, your host. Good morning, and thank you again for joining us on Healthy Minds, Better Future. Today we'll continue with what we ended up with last week. We talked about violence at home. We also talked before then about imported wives. This morning, though, we want to talk about our children and the effects of domestic abuse on children. As we know that children are affected by this, there's no question. The problem is, will the women who are being abused actually leave for the safety of their children? Will the children be saved from this mental abuse? And so for many of them, this is usually a lifetime of suffering. So today we have, of course, our officer, Natasha Williams. As you know, she joined us last week. We have Dr. Adeyemi Fatoki. We have Dr. Kenneth Soyemi. We have Dr. Olaleye. We also, of course, have Mrs. Dorcas Fatoki joining us, and we're going to discuss this in length. I want to begin, though, with a story. And that story I heard almost more than 25 years ago of a child who came to school, just cried all day. Not all day, I mean, as soon as she got to school, he wept. So the teacher kept asking, what's wrong with you? What's wrong with you? And then he finally broke and said, my mom is dead. And he said, ah, and you came to school? And he said, yeah, because my dad killed her and brought me to school. What he actually meant to say was that the dad had actually thrown a vacuum cleaner on the head of his mother and then drove him to school. Officer Natasha, what do we do about such an horror story before, of course, our medical expert and our contributors join in to talk to us about what they've experienced and how we can go and save some of these children and also help their mothers from such horrific abuse?
When the child relays a story, basically the teacher needs to get law enforcement involved right away, and law enforcement would go to the home to check it out to see exactly what was going on, see if the husband was there. Someone would actually stay with the child, and then they would send another set of officers to the home to check on the family, the mother, the husband. They get there and find that out. Obviously, the husband will be arrested. They get medical attention. The child would definitely need some medical attention as well, and some therapy, as well as the mom. Yeah. So usually, depending on what state you're in, the police can actually bring charges, even if the mother doesn't sign the complaint. The police will be able to actually sign the complaint and bring charges on the father, and the mother won't have to sign a complaint, because just based on the information that they receive from the child, the information that they receive once they went to the home. So it would be a lot of different entities coming together to actually try to help and assist that family. You'd have victim services there. You'd actually have Like I said, medical, of course. Uh, you definitely get DCFS involved. They do their own investigation. The children would probably be removed if it was, you know, if it turned out to be that was the case, the story. I'm sure they'd be removed from the home. Hopefully, there's other family that could take them temporarily until they could mitigate and help the mother out with some services, and maybe she'd be willing to leave if she didn't die.
Thank you so much. Dr. Fatoki, what would you say about such a story and what have you experienced or
You
heard
know,
of?
I haven't had explicit stories like that, but I've had situations where there's a lot of violence, whether emotional or physical or psychological abuse going on in the house, and many times the children, you just see in the way they are reacting, and also when the mothers will bring the child to the clinic, the mothers may be quiet, and it takes a lot of patients to try to tease the story out of them to get them to talk and get them the help they need. But many times too, the abused spouse is afraid to leave. And even when you've counseled them and you've made progress and you think they might leave, then you find out that they still didn't leave. So that's something that I've seen quite a bit in our community where people are just scared to leave, whether their finances are tied to that of the abuser, and also a lot of times I hear women saying they're staying until their kids are old enough to go to college, but they just don't realize the impact that abuse is having on those children for the next 10, 12, 15 years until they go to college.
Dr. Olaleye, you deal with children. This is your work. And so, can you describe or have you heard of such?
Some of the children that are witnessing violence of any kind or abuse of any kind in the home, they will most likely present to the pediatrician office with certain kind of illnesses, like headaches and stomachache, things that, I mean, you can prove the head is not hurting. So, or they come in like anxiety or depression, or some of them are acting out at school, and some are just aggressive because they're acting out the aggression that they're seeing in the home. They're acting it out outside of the home. So they present in different way, but most of the time it's tied to their behavior, or it's something that they some kind of somatic illness that they will bring in. And some of the children also can be part of the violence because sometimes the aggressor in the family is abusing the spouse, and the children too, especially if the spouse is not there, the children become fair game, and which is the reason why sometimes some of the in most cases the women that sometimes they don't want to leave, because it's like that level of protection that the mother can give so that the dad doesn't turn on the children. The mother is afraid that if I leave, then my kids, it won't let me take the kids, and then they might abuse the kids. And so it's just really a really bad thing. But and sometimes too, it's the men that are being abused, and they don't want to leave either. Because sometimes because they don't, why are you leaving your wife? Because she's abusing me. Their pride is in the way. They don't want to say it out loud. Yeah, but we really want anybody that is in that kind of situation to be mindful because of how much negative effect it is having on both the emotional and the physical health of the child. And there have been some studies that says even babies as early as 6 months can start having reactions to a house where there is constant conflict. And it does affect their behavior, it does affect their mental health, it does affect their physical health.
My practice is mainly in the juvenile detention center, and I'll give a very good example. There was this kid one day, he came in, we processed him, we wanted to send him to general population, and he pulled me out. He was just reluctant to go, so. And just based on years of doing this, I was like, okay, something is wrong, because kids don't usually want to stay on the medical unit. They usually want to go to the general population where they can participate in programs. So he pulled me aside. He said, well, I have ops and everybody's looking out to harm me. Then I asked what happened. Then he explained that there was an argument at home with his mom's boyfriend. And his mom's boyfriend was telling him to leave the house. Then he was talking to his mom on the phone, and his mom was saying, "I'm on my way home. Do not leave." So as soon as he got off the phone, the mom's boyfriend pulled the gun on him. He pulled the gun back on him, shot him in the neck, and he died right away. So they took him to the police station, and when they did the investigation, they realized that it was self-defense. So he was now sitting on our unit, could not go into the general population to to program with the other kids because of the fear of his life. So those are the kind of, I have several stories like that. And what we usually see is, what we are seeing is that we're seeing post-traumatic stress disorder, which manifests as flashbacks, hypervigilance, nightmares, emotional numbness. And what we are seeing, what it ends up showing up on our end, is increased aggression, the difficulty trusting the staff, then frequent disciplinary actions. We're also seeing a lot of depression, which manifests as persistent sadness, lack of motivation, and social withdrawal. And that shows up as refusal to participate in programs, just like the example I just described, social isolation, and the increased risks of suicide. So we are seeing the whole range from PTSD, depression, anxiety disorders, substance use disorders, aggressive and violent behavior, self-harm and suicidal ideations, cognitive learning disabilities, and you'll be surprised the amounts of kids that I cannot read or write, especially when they put in their sick calls. You read, you look at them, and you just bust out laughing. Oppositional defiant disorder is a big, huge thing for us at the Juvenile Detention Center. Conduct disorder and attachment and trust issues. And when you look at all these issues, everything ties back to the home environment.
Mrs. Fatoki, I know that you're out there dealing with, your clients, and also maybe mingling with younger people out there in terms of teenagers and also maybe young adults. And I just wonder, have you seen or have you experienced anyone who has come up as a child of abusive home who has actually adjusted well?
Not that I can recall. Not when you say adjusted well, no. I would say to this day they're still trying to adjust, from the trauma that they've experienced in the household. And then, like Dr. Soyemi said, a lot of them experience substance abuse issues. So that's still going on. We see a lot of that. And that's all that I've seen so far. I don't know anyone personally like that, but as far as work goes, yes.
So I think we're now up to just talking about this in general. So the effects of all of this abuse at home, with many, Dr. Shemi mentioned, Dr. Fatoki's mentioned some stuff, and also Dr. Olaleye. How can we save these children? I mean, what can we do? Not only the children, really, because we cannot save the children without saving their mothers. So, but because today we're talking about children, what can we do? How can we begin to address those issues? And how can we encourage those abused to really get their kids in safe environments?
I had a question for Officer Williams based on what Dr. Shiemi discussed. So I know you deal with the public, and we see a lot of juveniles that commit crimes. So when you're dealing with them, do you factor in what may have been going on in the house in the way the police approach them? Instead of, this is just a bad child, let's throw them in jail. Do you does the police approach it with compassion and try to factor in what the child may have been through, how the trauma has affected them, and try to maybe help before they enter the system, to see if they can be sent to programs that can help, them psychologically, medically, instead of just throwing them in jail?
It really depends on the situation. Uh, every situation is different. If they're in the act of committing a crime or have just committed a crime, you're going to deal with that issue first. And all of those underlying issues may come out eventually when the teenager is no longer in police custody. That may come out once they've been actually transferred to juvenile. Most of the time when you're dealing with teenage children that have been abused, they're really aggressive in nature. They put up a facade, and they need to be real aggressive and like a hard shell on the outside. So if you're dealing with that, when you're initially, your initial response, you have to actually initially respond to actually the crime that's going on. Now, if you're on patrol and you come into these teenagers often and all the time in the area that you patrol, then you may create a relationship with them where they are willing to tell you what's going on, and they kind of just need an outlet to talk to you. If they're having issues in school and things of that nature, and you've been called to their home several times, you kind of get a rapport with the kids as well as the mom, and they know that you're not there to hurt them, but they do understand that you have a job to do. So you will become aware of the issues that they are suffering in the home, outside of the home. They tend to gravitate towards you and talk to you a little bit more and let you in. So if something was to happen down the line where, you have to deal with them from a criminal aspect, then you already kind of know what they're going through and what the issues are, and you can relay that to the next officer or to the medical, and you can even write that in their paperwork, when you're dealing with that, when you're taking them to juvenile. And I know they do have a point system on the streets as far as juvenile is concerned, before they actually they get so many points before they're actually taken to juvenile detention. So if they have these little petty crimes and things of that nature, based on their age, they'll just have a conversation with them or make them go through some kind of training, and then they'll just return them over to their parents. So they get so many points. It's a point system, and I can't think of the exact terminology for it right now, but there's a point system where they go through, and then they get so many points before they're actually taken to juvenile based on petty crime. So now they're not really taking adults or juveniles to jail for little petty crimes. They're giving them a ticket, and they have to show up in court for those tickets. So that's kind of like the same system that they're using for the juveniles. They give them some sort of ticket, and they write it up and put it in the system, and they get a point based on whatever the crime was, or whatever it was that they did, whatever the infraction was. And once they get so many points, then they go to juvenile. But if they don't never make it up to that amount of points, then they don't ever go to juvenile. So that is a system that they do have out on the streets where they're utilizing in patrol.
Many times, the women are really at crossroads, meaning it's like they really want to save their children, but then they have what Dr. Fatoki mentioned earlier, how to do so. So, what would you say to a woman who is in this situation at this point? How can we help? Or how can you help as an officer? I've heard everything you said, but on a personal note, we're talking about children now. How do we get the mother to do something to put this child in a safe environment?
I would say to educate the mother on the different resources that are out there for her, and try to assist her with going into or becoming a part of some type of women's program for women of domestic violence or abused women. They have so many different programs out there where, she can become a part of it. And I would, basically educate her on the process of domestic violence and what she should do to actually protect herself and her children, like an order of protection, an emergency order of protection. I would, introduce her to victim services where they actually help with different paperwork that she needs to actually put in for housing and resources to help her to move beyond her situation that she's in. If she needed to leave the home and take the children, they have all these different programs where other people work with the victim to actually have them help them be removed from the home, and put them in another housing placement and help them with just services as far as food and groceries and furnishing the home and things of that nature, helping them to realize that they can actually move on from this situation and they don't have to live in this situation. So that would be something. And an order of protection for the victim and the children would be my number one thing that I would advise them to do. It's not something that the officer can do for them. It's something that they actually have to initiate. But if they have the information and they understand the process, then a lot of the times they'll go through with it and, the different steps of the order of protection and how the order of protection works. But a lot of the times we see victims, they do go and get an order of protection, but then they will allow the abuser to violate that order of protection and not report it to authority. So the abuser is constantly coming back in and out and even maybe harassing them through telephone calls or have you, and they will not report this because they still are trying to protect that abuser from the system, from going to jail, that sort of thing. So we find that a lot.
Dr. Fatoki, give us a clear understanding of the correlation between children who've been abused and what you do, which is to actually work with, I wouldn't say kids really, work maybe young adults or adults about what they've been through, the trauma of their childhood, and where they are now in terms of drug abuse.
So we deal with patients that have substance use disorder, maybe drugs, alcohol. And actually, I'm going to say a very significant number, probably way more than 50% of the adults that we deal with have had some kind of childhood trauma. So either sexual abuse, neglect, and that, they have PTSD from that. So a lot of what we see has roots in the childhood. So there is something called an ACE score, Advanced Childhood Event Score, that we have to do on all our patients, and a lot of things really come out during the while you're asking those questions. Either they've witnessed physical abuse or it's been perpetrated on them. The parents were separated, the kids were neglected, so they more or less start using drugs or alcohol at a very young age. They are not supervised, and it's not the way things are back home in Africa when we were growing up, that they say it takes a whole village to raise a child. When I was growing up, if the neighbors saw me doing something bad, they'll correct me. Sometimes they'll even whip me and then take me home to my parents and or tell me, let's go to your parents so you can go report yourself. It's not the same way here. Like everyone keeps to themselves. It's more individualistic. You don't want to get involved in someone else's business. So the children don't get don't get that kind of support, even when they are being abused at the home. Everyone turns to the other side because they don't want to get involved. I've dealt with a lot of people that are dancers, like strippers. I've dealt with people who do stuff on the internet, prostitution, and most of the time it goes back to some kind of sexual abuse, when they were growing up. So it's a sad situation. And yes, we see people who do well, but at the same time, those scars never leave. So that's something that they carry for the rest of their lives, and you see many people that adjust, but again, it's never the same, and it's just an ongoing thing, that something that a lot of us don't think about that happens in childhood is something that people carry on for the rest of their lives.
If I may ask Dr. Fatoki, what are you seeing with people from the African diaspora? Are you with the issue of drug abuse connected to what happened to them in their childhood? Is it
a lot of
thing?
a lot of alcoholism, a lot of alcoholism, a whole lot of alcoholism, and people are in denial. Then also, you tend to see that pattern of abuse being perpetrated onto the next generation. So the same way they were treated by their parents is the way that they're treating their children. So unless someone breaks that chain, and that's one of the things that I call a generational curse, unless someone realizes what's going on and seeks the help that they need, then it continues on and on and on. But yeah, we have a few people that use other drugs, but alcoholism is very, very common in the African population. I know in Nigeria there's a lot of drug abuse too, a whole lot, because I've done presentations in Nigeria with people. There's a lot of bath salts, a lot of synthetic marijuana going on especially in Nigeria, and you're seeing the effects of that, and again, even I have family members, like distant family members. I have friends, who are going through the same thing. And it's just difficult when the adults trying to break that chain. I have a cousin that died from alcoholism in the US, so it's something that we see, even though we are in denial of it.
And when you talk about the immigrant population, I think it's so sad because back at home, looking at how we handled stress or how we handle situations like this, is that first of all, you have your grandmother, you have your grandfather, you have your uncles, you have your cousins, and you have friends too. So we have that wonderful, really circle of support in which you know that you could run into any of those and feel safe. You can even say to your parents, I'm going to stay with my grandma. And even without saying that to your parents, your grandma can actually come and pick you up and take you home. But we've lost that now. We've lost that. Dr. Olaleye, what would you say about the fact that as immigrants, we have lost so much? We've gained a lot, but we've also lost a lot, especially in terms of family affairs and also family support. And when we have situations like this in our communities, what should we be doing? How do we regain the support that we had at home that we no longer really have here?
That's impossible to get it because all those people that act as that support system that you just mentioned, they're thousands of miles away, but you could still make do with what we have. And that comes along as your friends, you have close trusted friends that have become, some of the friends have become more of a family, closer than blood sometimes. Your place of worship, we are very spiritual people. Be it the mosque or the churches, we go, it's part of who we are. you can find some support system there. And of course, your doctors, talk to them. Yeah, whatever you discuss with your physician, it doesn't get out of that room, and they will offer you help, refer you for the mental health community. No, you are not crazy, because we have this negative thing in our mind that, oh, you are crazy in a bad way. That's why that's the only time you need a psychologist or a psychiatrist. No, you need help. Everybody needs help. Get support for your mental health. And I wanted to say that another reason that some of the families go through this and they don't seek help is because, especially when it comes to immigrant family, we're in denial. Well, if so long as the person, maybe one spouse is not punching you and giving you bruises, you probably don't even think it's an abuse. But when you guys are always yelling at each other, always having heated arguments, those are still very scary to the children. You can find the toddler trying to hide behind the sofa, trying to hide under the table, because you guys are yelling at each other, you're in each other's face, you're cursing each other's out. Sometimes the aggression or the violence come in different way. Not all of them is physical. And I still feel like the mental part of it can be worse, actually. The one that doesn't involve punching you can be the worst kind of abuse that the children are witnessing and they themselves are going through. And don't let us be in denial. Acknowledge there is a problem, because that's the first step. Acknowledge the problem, then you can seek help. And it's not always the women that is getting abused. Sometimes it is the men. Either way, it is negative. It has a negative effect on the children.
But we're now rounding up, and I would like us to just touch on one or two points to lead those who have been abused to help their children really regain their sense of safety and also have that sense of self-esteem. Because I will imagine that when you are raised in a home where people have been abused, your self-esteem must really go down the toilet, I feel. So please let us open, the floor is open. Please let's jump in and begin to discuss how we can not only help, but how we can help the children in particular.
So I'm going to ask Dr. Soyemi a question. So with you dealing with juvenile children, with juveniles, I'm sorry, so, again, in the immigrant community, when your child commits a crime, then the patient or the parents don't want to have anything to do with that child. So how do you deal with that? Like, okay, the child has been witnessing a lot of trauma, they've been abused, they end up in Officer Williams has tried to help them along. She hasn't succeeded. They've accumulated so many points. And then the child ends up with you. And then the parents are like, you know what? I don't want anything to do with that child. I'm not even going to go to court for them. I'm not going to show up. I don't want them to even associate that child with my family name or my last name. How do you deal with that, or what do you suggest? Because sometimes I know the crimes these kids commit, there might be mitigating circumstances, but when you just abandon them to the system, it's not going to end up good for them most of the time.
Just like you said, some people just generalize and lock up the door, throw the kids away. In some cases, I'll call the parents, because I usually tell the kids, I'm hearing your side. I'm just hearing your side. I'm sure if I call your parents, it will be a different side. And right in front of the kid, I'll call the parents. So it all depends. I'll give you a very good example. There was this kid that came into my office. We were talking. Then I just asked him a simple question about, how about suicide? Are you thinking of committing suicide? He said, no, I'm not crazy. Then he started crying. And it's very, very rare to see a kid come into juvenile and cry. So I asked him, what's the problem? He said, every time everybody keeps telling me I'm crazy. All they just do is once they let me out the door, they leave me. I'm on the streets. My mom doesn't want me. My parents doesn't want me. I end up in the psychiatric hospital. I've been in the psychiatric hospital like 10 times. I'm like, really? I'm like, okay. So I track down what we call the case manager, and those are the most important people in juvenile. I tracked them down. I'm like, what are we doing for this kid? Because I've looked at the record, the kid has come in about 10 times. Then I raised hell. I raised hell. I went up to the superintendent. I went up to the deputy superintendent. I raised hell. So everybody started doing their jobs. And they came up to me and said, you know what, doc, you were right. And this kid really needed it. They found a placement for the kid. They found the kid did not even have a state ID. So how is he going to get a job? He couldn't even get a state ID. So they really worked on this kid. So it all depends on how you listen to the kids, what they're saying, you listen carefully, and how it depends on you as a person. Are you the kind of person that would just go and say, go get there, this is just my job, I'm just going to do my job and close the door and collect a check? I'm not that kind of person. I'll put the kid in my child's position. If this kid was my child, what will I do? And that was what I was ramming down their necks. I'm like, if this kid was your child, what will you do? Will you allow me to keep going back and forth into the strike hospital 10 times? Then everybody's eyes on that one, they listen to me. So it all depends. It depends on how you want to approach the job and how you want to approach the kids. And one of the first things I do when I talk to the kids is I'm like, who's your favorite rapper? And then they just start laughing at me. They'll be like, what do you know about rap? Then I now start talking about the rap culture and everything. They'll be like, oh, doc, so you know about all this thing. And next time they see me, it's a totally different interaction. So I don't treat them like criminals. I just treat them like my patients.
So what I hear you saying is that the bottom line is that whatever we do, we need to advocate for the people that we deal with. You know, just like Officer Williams has mentioned, even what we do in the substance abuse, it's not just to look at people when they come in and say, oh, this is a drug head, you know, I don't want to be bothered with them. Because behind whatever you're seeing, there's a real human being. There's someone who is crying out for help. There's someone who may have been traumatized, and there's someone who wants to do better. You know, one thing that I learned that really got me into substance abuse, and Dr. Soyemi and I worked in corrections together for many years. The one thing that baffled me is like, why would people want to keep doing this to themselves? And that's what started changing my perspective, because I had kids that would call me and say, oh, doc, I'm never coming back. And then I go back 2 months later, they're back again. So then I'll start kidding around with them. When they say, oh, doc, I'm going home tomorrow. And my question is, when are you coming back? You know, so we'll laugh about it. But then there's some pain behind some of that hardness. Like, you know, behind that hard shell, there's some pain behind it. And it's good to just be an advocate. Like Dr. Soyemi mentioned, I'm not there to collect a paycheck either. I take pride in my patients doing well, the people that we interact with. I mean, it's the most rewarding thing, you know, so we can't help but being advocates for the people we deal with. You know, just think human beings are generally nice. Yes, there are some hardcore criminals. There are some people with antisocial personalities that you can't change. But I'm going to say for the most part, there's some goodness behind that mask that you're seeing. They just need an advocate, someone they can talk to.
And I've seen kids who have gone on to do very well with their lives in the airports, in the hospital. They walk up to me. Do you remember? I'm like, no. From juvie, I'm like, oh, okay. Okay, so you're doing well. And I said, oh yeah, I've put all that behind me. So yeah, so they're kids that end up doing well with their lives.
To add to that, when I worked for Child Rescue, that unit, we would deal with a lot of children that were a part of the state, and they had a lot of issues and a lot of trauma from home, and you never know what they see, and you kind of spend more time with them versus if you were out on patrol and you encounter them. You have a little more time to have a conversation with them. You have some children where you're rescuing them and taking them to maybe a center for young women, juvenile women that are under the state, and you would actually try to help facilitate and give them information on what they need to ask and how they need to ask, and different services that they need to ask for when they're with their caseworker, so that they can prosper and go on to do better and greater things in lives. You know, you'll find a lot of the females, they do drugs, and they get high and they hang out with men just because they don't know their worth. So you kind of have to try to give them a pep talk as you're transporting them from one entity to the next, you know, and you find out a lot about these kids, that they really want to go to school and they really want to go to college and they don't know how to pay for college. And you kind of have to give them those services on how they can proceed to the next thing. And then you get some where you run back into them and they've actually changed their lives. So the system can work. I think it's definitely, you have to educate people.
And that's what we are trying to do. You know, the one thing that I'm thinking about, that I'm sitting here too, is that behind that officer with in the uniform with a gun, and behind that doctor in the white coat, they are actually normal human beings. You know, here we are, away from being all professional, being dressed in a white coat, where the patients or people are scared to talk to us as physicians, or Officer Williams in uniform that, oh my God, there's the police coming to my house, I'm in trouble. But I think we are showing that behind all of this, we are real. Even though we are professionals, we are very real people also, that people can talk to, and you just don't have to feel uncomfortable because someone is dressed in their professional outfit, and be afraid to talk to them. You know, behind every professional, they are still a human being with a family, with you know, who do things just like you, who cares about what you do. And we should just encourage people to feel free to share their information and seek help when they need help. You know, you see that officer on the street, even though you might have been traumatized, you shouldn't be scared to walk up to them and say, you know, officer, this is what I'm going through. Or doctor, I know you're treating my diabetes, but this is what I'm going through. You know, we should encourage the people we interact with to be able to talk to us and trust us to help them in any way we can.
Yeah, that actually goes a long way, being able to trust someone. So as far as like advocacy goes, you know, like when you're dealing with someone in the home, like a parent that's getting abused, I would say you want to make sure that parent know, hey, you need to get your child out of this situation. And also, like Officer Williams said, you want to make sure that you give them the resources, because a lot of times they don't know how they can maneuver out of these situations safely. There are a lot of times where, especially like the mom, have gotten out of these abusive situations, and they eventually got killed, or you know, something of that nature. So if you can provide them with real resources where they can feel safe getting out, then that'll be like one of the best ideas.
And I'm pretty sure that people can also find out some reasonable information online on the website, uh, if they try. I mean, nowadays it's like you can practically almost find anything and everything about where to go for help for certain issues that are going on. And yeah, everybody got to find somebody they can trust and talk to them and open up and get the help they can. Everybody wants to help, honestly.
Thank you, everyone, and particular thanks to Officer Natasha Williams for joining us twice now. Wow, we've taken 2 of your 2 days. So we thank you so much for being with us. We really, really appreciate it. So thank you, team. I mean, we've been on this for a while, and we hope that we're helping in the communities that we are trying to reach, not only the immigrant communities, but those who are quite underserved, and they really need the help. So what are we saying today? We're saying that a lot of children have issues because they came out of homes with violence. We're also talking about women who allow their children to witness such violence. And we're seeing the long-term effects can be really devastating. We've heard from the officer, we've heard from doctors who actually are interacting with children such as those we've described. So today we're saying to you, we want you to be vigilant. We want you to look within your families and your communities and really begin to have ways in which we can help families thrive. So we are calling upon you to please get some resources, get some support system around you. We have talked about, of course, our religious homes and also churches, centers. We've talked about even the park districts. We've talked about the police officers and your medical practitioners. So we're saying to you, we don't want long-term effects of children from abusive homes to be so devastating that they can't even have better future as we are prescribing. So today we call upon you to please see what we have as resources as we finish this program. We have that on the screen, and get in touch with how you can be helped. So we thank you for joining us today, and we pray that you will have the courage to be vigilant. Not only that, to also know to find a safe haven for the children that are coming from those homes. So we thank you, and we hope that you will join us next week as we continue with Healthy Minds, Better Future. Thank you. Thank you for joining us on this episode of Healthy Mind, Better Future. Pressures of life can get you down. Don't lose hope. Exercise your mind daily so you can function positively in society for a better future. Continue to join us as we offer tips to navigate your challenges and bring you mental wellness. Your healthy mind is key to your better future. Please subscribe and share our podcast. Someone out there needs encouragement.